Hi all, Dr. Paymer here. There's been a lot of patients recently that have succumbed to the cold or some type of bug that's been going around, myself included. My family's gone through it. I want to go over some myths and also what you can do to help support your system when you're going through these times. Most people think that the cold or flu is from a bacteria, and actually that's very rarely the case. The cold is often a result of a viral infection, and so if you're getting an antibiotic from the doctor, those antibiotics very rarely do any good because it's not of a bacterial cause. So that's number one. Number two is we often treat the symptoms of the cold or flu with something that's either a medication or over-the-counter drug that will often suppress your immune function long-term and also extend the time that you actually suffer with your symptoms. So keep that in mind. Antibiotic use is really not a good idea for anyone, especially young children. It increases the risk of asthma in children under the age of 2, as well as they found linked to obesity by the time they're age 7, because antibiotics wipe out the natural gut flora that resides in your intestinal tract, which has a very symbiotic relationship with your digestive and immune function. So it's very, very important that we have that balance. So antibiotics are really never recommended, again, unless it is a life or death situation. Most of you going through a cold, yeah, it's no fun. In fact, there are some days it's miserable. You've got a runny nose, you're sneezing, you're coughing, maybe your throat hurts, you have a low-grade fever, but you're not dying, and that's a very, very big difference. So do not try to suppress what your body is already doing, which is fighting that infection. You want to support what your body is already doing, and I want to give you some tips on how to do so. Number one, make sure that you're getting adjusted even a little bit more frequently when you have a cold. You may not feel like coming into the doctor's office, but every time you get adjusted, you're actually giving your immune system a bump, a boost. So it's very important that you increase your adjustment activity. Number two, drink lots of water. Especially in the wintertime, we tend to decrease our water intake. We actually need to increase. People get dehydrated in the winter just as they do in the summer. We just don't think about it, but because we're respiring, the respiratory tract has to act more to be able to heat the cold air that comes in. You need to make sure that you're drinking lots of water because lots of water is being used. Also, you want to eat clean, whole foods when you're, well, all the time really, but especially when you're not feeling well, when you're sick. Avoid processed foods, avoid fast food, and certainly sugar, because whether it's bacteria or virus, your body becomes acidic when you eat lots of sugar, and it makes a breeding ground for all types of infection. So those are very important things you need to know. Now, what can you do remedy-wise to help out? First thing, get moving, exercise. If the cold is just from the chest up, getting movement in there, breaking out a little sweat is just going to help increase your immune function. So that's never a bad idea. Get lots of sleep, drink water, as I said. You can also take apple cider vinegar. We're often very acidic when we do have a cold, so the apple cider vinegar, 1 to 2 teaspoons a day, is going to help to lower the acidity and help your body to fight off that infection. Raw honey in warm water with lemon squeezed in. You've got natural sources of vitamin C. Honey has natural infection-fighting properties to it, so that's always a good idea. As well as colloidal silver. Most people haven't heard of this, but colloidal silver has been dated back many, many years to have natural antiviral properties. So a couple of drops in the mouth, on a daily basis for about 2 weeks or during the duration of your cold. What else can you take to supplement? Zinc, vitamin C, vitamin D, and magnesium. Most of you have heard of those things that you want to take during a cold. Also oil of oregano. It's very spicy, so you don't really want to give it to kids. You take just a few drops, put it in a little glass of water, and just down it. You'll want to take that in the first week or first few days of your cold. Raw garlic, you can take that as well. You want to crush it. If you don't like the taste of raw garlic, make up some salsa and just eat it. Salsa is a good thing. Understand that a cold is not something, sometimes we're blessed and we only have to endure that cold for 1 or 2 days, but the natural process of the body can often take up to 2, if not 3 weeks, because there is a time when the infection invades, the body has to recognize that infection, then it starts building up immune function, it starts building the troops to fight off that infection, and then there's a process of actually fighting that infection. And so that is usually a process that takes anywhere from 1 week to 2 weeks and even upwards of 3 weeks. So realize that it does take time. The more you can support your system through the advice that I just gave you, doing the remedies that we just talked about, the better you're going to come out at the end without suppressing your immune function long term and without taking an antibiotic, which will do very little good and actually cause more harm than good. Remember, medications, including antibiotics, should never be taken unless it is a life or death situation. They are meant for crisis emergency care only. The other 99% of the time, you need to be taking care of your body, supporting your health, your immune function, and taking responsibility for what you do. Okay, hope that helped. Have a blessed day. We'll see you soon.